This video will teach you how to provide effective cleaning and disinfecting services in Microcleaning Solutions healthcare accounts. Our healthcare accounts include doctor's offices, dentist offices, and surgical centers. These accounts have two things in common. They have a higher rate of germ and disease transmission, and the need for disinfecting in healthcare accounts is greater. Anyone working in a healthcare environment should know their role in reducing the risk of transmitting infection. Our cleaning system includes the use of color-coded microfiber cleaning cloths and mop pads, flat mops, flat surface cleaning tools, HEPA backpack system, and microfibers. We use a color-coded cleaning system to prevent cross-contamination and the spread of germs in our client accounts. Cross-contamination occurs when you take a fiber or a mop and clean one dirty or germ-contaminated surface and take that same mop and clean another. An example of this would be cleaning a bathroom toilet with a fiber and taking that same fiber and cleaning a desk or kitchen countertop. We also use HEPA filtration vacuums to remove 99.97% of dust, dirt, and bacteria in our client accounts. We use special color-coded microfiber mops to prevent the spread of germs in our client facilities. This reduces cross-contamination as well. And we also use special chemicals and disinfectants that are fungicides, mildewstats, virucides, and deodorizers. Color coding is an important cleaning method to prevent cross-contamination and the transmission of germs. Cross-contamination is a major concern in healthcare facilities. So, when cleaning, we use a color-coded system for wiping and mopping that prevents this. Color coding for health includes the use of special colors to clean different surfaces. Our red fibers are used for cleaning in areas with potential biohazard. This could include areas with blood or other body fluids. Blue is for any general cleaning area that's not a restroom. Green is for restrooms. And yellow is for restroom areas that don't include toilets, such as restroom counters and partitions. As you can see, the color-coded fibers include green, yellow, red, and blue. Remember, when you are cleaning a healthcare facility, never leave dirty mop pads or microfibers laying around. Please remember to put fibers in a separate container or bag. And while you're cleaning, check the vacuum bag frequently. There are certain important precautions that you must also remember. Use gloves at all times when you're cleaning. Use protective clothing, including shoe covers and hair covering, when you clean surgical areas. Also, wash your hands before and after you put on gloves when cleaning. Hand washing is the most effective way to prevent the spread of infection to yourself or within the facility. Hand washing requires a minimum of 20 seconds washing using liquid soap to ensure your hands are thoroughly clean. Also, always turn the water off with a paper towel. If you have any questions on our health-based cleaning techniques, please speak to your shift supervisor or call 330-780-1480 and asked to speak to our Microcleaning Solutions Director of Operations.